What's up, YouTube? Today we're talking about the larger institutional issues that cause poverty and their effects on mental health. So when one is in poverty, there are a lot of personal and institutional factors that affect their mental health. These factors can include access to resources, lower payment, and stressing about, when they're going to put food on the table next. These issues can cause a decrease in mental health in low-income communities, and historically, these two issues, poverty and mental health, are very closely connected. For example, in the start of industrialization, in big cities, there was a large increase of people moving in, which caused a lot less opportunity for jobs and pushed a lot of people into poverty. This got even worse in the Great Depression, when, there was a big fallout in the economy and a lot of people were worried about money and all those other factors, and that caused a big mental health dip in America. One piece of legislature that I found that can help with this possibly is California Assembly Bill number 1115. This bill is on a smaller level, but I feel like we could expand it. It's getting specialized law enforcement officers to be able to help other law enforcement officers with their mental health. I feel like we can expand this bill to affect even more people in different communities. We have a lot of people that are specialized in mental health and have a lot of clinical experience in that. And if we are able to allocate those resources correctly into our communities, I feel like it can have a really big benefit. For example, we could have free mental health screenings at public places, especially in common low-income areas such as food banks, even just like town halls, like city halls, stuff like that, public areas where people can easily access them. That could be a really good gateway into getting mental health help for other people. So really, a lot of it is the stigma around mental health, especially in low-income communities. So if we as a community, you as a viewer, can help change that mental health, have these open and hard conversations about mental health and let people know that it's okay to have mental health issues and struggle, and even to go find help especially. That could change the narrative, make people feel like they can go out and actually talk about these issues to others, and hopefully lower the stigma for mental health. Later.